Today, we have pediatrician Dr. Michelle Perro, who is going to report on the current state of children's health. Dr. Perro is a veteran pediatrician with over 41 years of experience in acute and integrative medicine. She has both directed and worked as attending physician from New York's Metropolitan Hospital to UCSF Benioff Children's Hospital in Oakland. Dr. Perro is the author of the book, What's Making Our Children Sick? How industrial food is causing an epidemic of chronic illness and what parents and doctors can do about it, and is the founder of the organization GMO Science.
So I'm going to share this high-tech presentation with you, and I'm going to look at my slides with you, and what I'm talking about is my favorite topic, which is the state of our children's health. And looking at some of you in the audience today, you could be some of my patients, looking at those adorable young faces. I'm so thrilled you're here. So I want to begin by talking about this book I wrote 6 years ago. And it's basically what's making our kids sick and about industrial foods. And since that time, in this short 6-year period, things have become abysmally worse in regards to the state of our children's health. And we're going to get into the weeds on what has happened. So I want to talk about the true pandemic, which is the chronic poisoning of our children. I'm all known for about being dramatic. I work with children, right? And the crime of our times. And before I get into that, I'm just going to do a mini quick survey. Any of you here have children? Okay. Grandchildren? Any of you know a child? Any of you do babysitting? Any of you like children? Any of you prefer your dog to your child? Okay, all right. I just want to talk about children in terms of our children. We're not talking about our children or their children. This is our children, right? This is American children, and they're being chronically poisoned every single day, and that's happening at school. And I'm going to tell you why and how that affects their health. So everyone loves statistics, right? I can't give a presentation without getting to talk about stats. Let me share a few stats with you. I'm going to start with asthma, which is basically an autoimmune disease, by the way, and that affects about 1 in 6 to 1 in 8 children. And if you're Puerto Rican, 1 in 5, that other country of Puerto Rico. No, I mean the other U.S., Commonwealth. Eczema, 1 in 5 kids, 60% of infants have eczema, and parents will do anything to stop the itch that their kids experience all night. They're up all night, and when parents are up all night, parents are cranky, families are cranky, kids are cranky, everyone's cranky. We'll talk about allergies. 2 to 3 of children have environmental allergies. Although that's not life-threatening, kids are miserable doing this all day at school, right? Rubbing their goopy noses, and they can't concentrate, and they look like that. It's terrible. We'll move on to food intolerances. I'm from California. This is not a juju phase out of California. Kids are really gluten, dairy, soy, and corn intolerant. And I bet if I would do an informal poll out there, most of you would have gut issues. Of my patients, 90% had gut issues, often undiagnosed by conventional medicine, particularly high kids in the spectrum, autism spectrum. We're going to get into that. And obesity. Obesity is not a benign disorder. It goes on to develop metabolic disease later in life, cardiovascular disorders, autoimmunity, and cancer, affecting anywhere from 1 in 3 to 1 in 5 kids, depending what state they live in, and it's a national crisis. I have some stats for you on the table in this handout, which I loved all the way from California, making copies. Copies are very heavy, by the way, in case you're worried. And any references I give you are located in this handout and online at gmoscience.org. This whole talk, all our talks are cited and referenced, because otherwise we get skewered. Otherwise we wouldn't be valid. That's what I meant to say. I didn't mean to say we get skewered. So this is what our kids look like. If you don't believe that, go to a public school, or you can even go into a playground, and kids don't look the same way they look for some of us sitting here on this panel. And while this gentleman sets up the projector, I'll keep on going. Is that cool? Okay, let's keep chatting. But what really rattled my cage was approximately 20 years ago when I first started seeing the uptick in autism spectrum disorder. When I was training at Bellevue and NYU in New York City, we were called into the room to see a kid with autism. I'll just call it autism. It is the spectrum. And now it's about 1 in 10,000 kids. And now it's about 1 in 36 kids nationwide. And in California, 1 in 20 to 1 in 22 kids now is on the autism spectrum. And that indeed is the elephant in the room. Not to mention, we are seeing millions of kids now with increased rates of neurocognitive disorders, emotional lability, mood disorders, not to mention sleep. Up to 44% of children have what we call dysomnia, sleep disorders. They cannot sleep. That's almost half of kids. And that's not including kids with neurocognitive, neurologic issues. The number goes higher. No sleep, that means no health. Your immune system works at night. Your brain cleans out via your lymphatics at nighttime while you're sleeping. So forget those all-nighters working, working, and you want to get your sleep. So let's talk about the herd of elephants in the room about COVID impacts. And you might say, why is she talking about COVID? We're here talking about school lunches. Well, what does that have to do with anything? Well, I'm going to tell you, right? You're not going to tell you. Why? Because a lot of things happened during COVID. You know, everyone knows what happened during COVID. Kids experienced social lockdowns, stressors. They weren't able to see their peers. They weren't able to go to school. And that created a lot of mental health issues. And since that time, mental health was a problem prior to COVID. It has gone up since COVID, particularly anxiety and depression. There was a study of the UK called the Myriad study. They looked at 28,000 kids in the UK. It's a lot of kids. And those numbers of depression, anxiety skyrocketed. Ours were even higher here in the US. But what did protect kids was going back to school. That was protected in terms of mental health. So we want to get kids back in school. It's a positive environment for children. But I would be remiss if I didn't mention the fact that during COVID and otherwise, the kids who are impacted most are kids with impoverished backgrounds and kids of color, and those kids got hit the hardest by far. So that is something we need to focus on, food justice as well. This is a conversation we need to have. Many children, particularly children of food scarcity, receive anywhere from 1 to 3 meals a day from school. That's how many meals they're eating in school. So all their nutrition comes from school lunches. So it shouldn't be a wallop, right? We should give them a good impact, because that's where they get the majority of their food intake. So let's go back to school. What did I even say here? I basically said school nutrition is one of the best ways to support children's learning back to school and back to health. Okay, so far so good, right? You're all with me? We're still awake? We do have organic coffee over there. So a couple of things. I want to do a little side step here, a little sidebar. Let's just switch a little bit, but we'll get back to the big Broadway moment. Don't worry. I want to talk about this National School Lunch Program. And this was low cost of free lunch program for kids. And this program expired in 2022. During COVID, we were giving out school lunches to kids. And so kids who were used to receiving their nutrition from school were then cut off. There are dietary guidelines set, federal guidelines by the USDA, and school meals must meet these federal guidelines. And if you go online, and I gave you the website and it's in the handout, these guidelines are fabulous. Like, wow, look at these guidelines, they're tremendous. Very impressive. Things like whole foods, veggies, grains, dairy, and they say include fat-free or low-fat. Kids should be eating full fat, by the way, full fat for children. Protein foods and oils, preferably no seed oils, by the way, they're not so healthy. Kids have very high omega-6, you want more omega-3s, but we can talk about nutrition after this. We're going to be hanging around so you can ask questions. So I say, wow, look at these guidelines, fabulous. But the bigger question is, are school lunches meeting the USDA guidelines? That is the question we pose. Let's take a look and see if that's true. Are they doing that? Well, Moms Across America and Zen Honeycutt did this study, and Zen will go into the details about the study, but I want to pull out a couple of key points in that and look at it from the health perspective. I'm the pediatrician, right? So we'll talk about health. And 95% of those school lunches contain glyphosate, one of the main ingredients in Roundup. You all know what Roundup is, right? Anyone here not know Roundup? No, you all know Roundup. Okay, Roundup and its breakdown product called AMPA, as well as other pesticides, and you're going to hear about that. 100% of those school lunches contain heavy metals. Heavy metals are not benign. They are neurotoxic. They cause every disease known for children, including neurological disease and cancers. We'll go into that a bit, and veterinary drugs, because our school children should have a dose of veterinary drugs and veterinary hormones that we give to chickens. Maybe not so healthy, right? Some of the nutrient levels, well, actually most of them, and Zed will discuss that with you. Not to mention absent, like which ones were absent? Vitamin B9 and B12. Those vitamins, in case you don't know, are methylating vitamins, which means they help you detoxify. And kids cannot detoxify because they don't have these nutrients. So they cannot clear the heavy metals, right? So they're a toxic mess, hot mess. But another sidebar here, quick sidebar, because gosh, look at this EPA, the Toxic Substances Control Act. Any of you familiar with the Toxic Substances Control Act? Well, oh, I see some heads nodding. Good, I wasn't. This was passed in 1976, and then President Obama kind of cleaned it up in 2016. But what's very interesting what this act said, and I'm going to read it to you. I didn't memorize it. And what it said was, the Toxic Substance Control Act of 1976 provides the EPA with authority to require reporting, record keeping, and testing requirements and restrictions relating to chemical substances and or mixtures. Certain substances are generally excluded from this act, including food, drugs, and pesticides. However, it doesn't exclude heavy metals. Right, so what does that mean? I gave you an article, it's in the talk, it's in the handout, showing that those heavy metals are toxic to kids in the worst way. So based on the EPA, their own position and that act, they must ban present school lunches. Lunches tested are 100% positive for heavy metals and pose an unreasonable risk to the brain, cardiovascular system, and cancer. So by the EPA's own act, school lunches must be banned. They're a health risk to children because, as if the pesticides weren't bad enough, that our kids are eating 1 to 3 times a day, they're eating heavy metals with each bite. Let's move on. Have I depressed you all? Significantly good. We'll end on a positive note. We're solutionaries. So, our timing couldn't be more perfect. Yesterday was World Food Day. Hundreds of thousands of kids tuned in to this online event promoting organic regenerative farming. And I thought our timing here, us being here with you today, was just perfect. So let's get into the toxicity of glyphosate. I've been studying this problem for 23 years. I told you, you heard I've been practicing for 41. I know more about glyphosate than my own children. So I'm going to tell you what it does. I broke it down for you in simple terms: gut, brain, and metabolic. And we'll go through it a little bit. You guys are interested in what it does to you? Sure, you're eating it every day. It's in that pizza that they're serving in the cafeteria. But let me go through it with you. One of the main things it does is glyphosate's an antibiotic. Monsanto now Bayer patent that in 2010. And it kills off your gut microbiome. We figured that out in 2013 from a veterinarian study out of Germany. It kills off lactobacilli and bifidobacteria, promoting the propagation of pathogenic microbes like Clostridia, super high in kids on the spectrum, autism spectrum. How do I know? Because I test them. That's how I know. And Salmonella. So it's antibiotic. That leads to things like irritable bowel syndrome and inflammatory bowel disease and autoimmune disease. 1 in 10 kids now has autoimmune disease. That's shocking. And it causes something called leaky gut and dysbiosis, an abnormal microbiome. It causes brain issues. I didn't say correlate, I said cause, which it means in 2020 a paper came out which showed how glyphosate causes autism. We've been studying pesticides in the Salinas Valley, a growing region of California, for the past 20 years at UC Berkeley. The data on how pesticides harm children's brains is out. It's called the Chamacos study. Dr. Brenda Eskenazi is the lead researcher, and ADHD in that community is off the charts, not to mention poor birth outcomes. It chelates minerals. It's a mineral chelator. It binds metals, like which ones? I know you want to know. You're dying to know, right? Zinc, magnesium. Those levels are super low in the kids because we test them, right? If your pediatrician is not testing them, they're not doing their job. And you need magnesium in over 200 reactions in your brain. So kids have no metals, no brain function. This is simple math, folks. It's contaminated with heavy metals. The actual pesticide formulations are contaminated with heavy metals. That was the work of Dr. Gilles Seralini in France in 2015. So we know that there's arsenic, cadmium, cobalt, chromium, and other delightful metals in the pesticide formulations. What else? It causes NAFLD, which is non-alcoholic fatty liver disease, affecting 1 in 3 adults, 25% of the global population, 13 to 70% of kids, and up to 33% of obese children. And it's silent. It goes on to create steatohepatitis, inflammation of your liver, and eventually fibrosis. Causes kidney damage, and I'll share an anecdote with you briefly about kidney damage as well. Inerts, the companies don't mention what those are. Those inerts are also unidentified substances in the formulations or endocrine disruptor, and it causes cancer. We have an epidemic of kidney disease in Central America. It's called Mesoamerican nephropathy. We know they say, well, we don't know what causes it. Yes, we do. They're all spread glyphosate. I had a patient with kidney disease. He wasn't my patient. I treated his son. The only thing I did with that dad was change his diet from conventional to organic. He came in with 20% renal function. 8 months later, he had regained 80% of his kidney function. He was on the dialysis list. He's in this book. I wrote about him. That was the most shocking case I ever heard. He went to his UCSF doctor, and what they told him was, well, we must have misdiagnosed you. Diet alone cannot reverse your kidney disease. I guess it was misdiagnosed with 12 years. Shame on UCSF. Okay, last but not least, I'll be wrapping up. I'm kind of over my time here, but I would be remiss if I didn't share with you that pesticides cause cancer in children. This is recently published right out of DC from the National Center for Health Research. And they state, may I read, even small amounts of pesticides are very harmful for children, causing behavior problems, harm children's thinking memory, and increase the risk of childhood cancers. I don't even know why we're having this conversation further. That should be the coup de grace. Right there, everything should stop and getting the pesticides out of our children's school lunch. Children are not mini adults. And be clear, there are no studies on the toxicologic mixes of these chemicals in our children. So, and what we're not saying is ban Roundup and bring out a more toxic pesticide like 2,4-D dicamba. We're not saying that. But be clear what we're not saying. Last but not least, being clear that GMOs are not benign. They become so common in our vernacular, people think they're benign, they're not. The first scientist to study this, Dr. Arpad Pusztai, he found that GMOs cause reproductive harm, gut issues, and immunologic harm. And after he announced his findings in 1998, he was a hero in UK for 2 days before he was banned. They closed his lab. He developed got a heart attack, but he survived. This is not a HIPAA violation. He tells his story in a movie called Scientists Under Attack. When you eat a GMO, which is just about everything you're eating, corn, soy, canola, alfalfa, sugar beets, 50% of Hawaiian papayas, innate apples, innate potatoes, Arctic apples, we can go on and on. What is a genetically modified organism? And for our FDA, they are not labeled, but you guys know that. So, just to wrap it up, school lunches in France. School kids, there's a film about this, 8 American school lunches. Those are those little plastic wrapped plastic chicken nuggies with French fries that have acrylamides in them with a little ketchup as a fruit. Microwave with an extra dose of plastic. And those French kids would not eat those American school lunches. And as a matter of fact, they want to know where the brie and the camembert was on their school lunch plate. A little bit of a different story, wouldn't you say? So, anyway, I'd like to thank you for your attention, and I'm going to pass the mic on to my friend and colleague, Zan Marie.